Legalization of marijuana is a very controversial topic in the United States today. Some believe it should be legal for medical purposes, that it may even boost the economy. Others believe it should be illegal because it can be addictive to some people. It's a gateway drug, and it's often treated as a drug such as heroin and cocaine. And an article by Business Insider states that the following states have medicinally and recreationally legalized marijuana, and those include California, Colorado, Maine, Massachusetts, Nevada, Oregon, Vermont, and Washington. And the following states have it illegal, it is illegal recreationally and medicinally limited. And those states include Alabama, Georgia, Idaho, Indiana, Iowa, Kansas, Kentucky, Mississippi, Oklahoma, Missouri, Nebraska, North Carolina, South Dakota, Tennessee, Texas, Utah, and Virginia. I believe marijuana should be legalized medicinally in all 50 states. The two main ingredients of marijuana used for medical purposes include THC and CBD. THC increases appetite while decreasing nausea and can also decrease pain, inflammation, and muscle control problems. It's also what gives the high feeling. CBD, on the other hand, does not produce the euphoric feeling that THC does. And it can also decrease pain and inflammation as well, and also control epileptic seizures, and possibly treat mental health issues and addiction. There are side effects to marijuana, but compared to medications used to treat other medical conditions, marijuana doesn't have adverse side effects, but it does have the side effects including red eyes, dilated pupils, dry mouth, increased appetite, and delayed reaction time. There are other ways to ingesting marijuana other than inhaling it, and those include with edibles, with cannabis-infused beverages, with sublingual tablets or sprays to put under your tongue or spray on your tongue, with transdermal patches to put onto your skin, or with topical creams. 3 medical conditions that I believe can benefit tremendously from medical marijuana is cancer patients receiving chemotherapy and radiation, patients living with chronic pain who are prescribed harsh opioids or narcotics, and patients who suffer from epileptic seizure disorders. As stated in Fundamentals of Nursing by Patricia A. Potter and Anne Griffin Perry, patients receiving chemotherapy and radiation suffer from very undesirable side effects such as nausea and vomiting, appetite changes, constipation, and hair loss, etc. Cancer patients are very sick as it is, and it is key that they get the nutrition that they need. In the article, A Scientific Explanation of How Marijuana Causes the Munchies by Joseph Stromberg states that THC, the main active ingredient in marijuana, increases our sensitivity to sensing flavors by using natural occurring neural networks to trick our brains into thinking that we're starving. And that can really help cancer patients who are very nauseous, but once they ingest either the THC or the CBD oil, it can get rid of the nausea and increase their appetite. In the article, Marijuana is Medicine by the National Institute of Drug Abuse states how recent animal studies have found that marijuana extracts may help kill certain cancer cells and decrease the size of others. And it also states that when used with radiation, purified extracts of THC and CBD oil increase cancer killing effects of radiation. Chronic pain can be a very debilitating condition, and it affects many aspects of patients' lives, such as their mood, health, and overall well-being. And they are often prescribed very harsh narcotics or painkillers, and they can be very addicting, and there are a lot of side effects to them. And as stated in Fundamentals of Nursing by Patricia A. Potter and Anne Griffin Perry, the side effects of these pain medications include sedation, dizziness, nausea and vomiting, constipation, physical dependence, tolerance, and even respiratory depression. The U.S. is experiencing an opioid epidemic with a drastic increase in fatal overdoses. And from a medical standpoint, I believe that it began when pain became a vital sign and doctors began to prescribe pain medications to patients who claim they were experiencing a lot of pain. And because those pain medications are very addicting and their tolerance increases as you take it over a long period of time, I believe that using marijuana to treat pain and to treat patients with chronic pain can really help the pain and also decrease and help the epidemic. In the article, Marijuana Treatment Reduces Severe Epileptic Seizures by David Noonan states that medical researchers have confirmed that CBD can reduce epileptic seizures in some children and that it is an effective anti-seizure drug for this disorder. And during the study, there were 120 children and teenagers with a rare epileptic disorder marked by drug-resistant seizures that can be almost continuous in some cases, which is very dangerous. And with the treatment of CBD oil, their seizures decreased drastically. Marijuana is classified as a Schedule I drug, which lies in the same category as heroin and cocaine, and is considered even more addicting than methamphetamine and fentanyl, which lies in the Schedule II illicit drugs. And in my opinion, I think that is ridiculous. And it would be very foolish to disregard the potential for marijuana to benefit patients, society, and even the economy as a whole. And I hope that we continue to research and prove what marijuana has to offer in the medical field. Thank you.